get into health maintenance in the second trimester. During the second trimester, a pregnant woman begins to feel more like herself, and she may actually begin to enjoy her pregnancy. The nausea and vomiting are gone, her constant need to void due to the uterus pressing on her bladder is lessened, as the uterus is now up and out of the pelvis, and she's looking forward to delivering her baby. During the second trimester, the patient returns to the outpatient office every 4 weeks unless she has some type of problem that's been identified. If she stopped taking her prenatal vitamins due to nausea and vomiting, she should resume them now that she feels better. Remember, the prenatal vitamins have that extra 1 milligram of folic acid in them to prevent the neural tube defects. Even though the neural tube is closed by this point, it is still helpful throughout the rest of the pregnancy. Another thing to remember is that if we had to discontinue the prenatal vitamins because this patient had nausea and vomiting, we probably gave her a prescription of folic acid 1 milligram without the vitamins to take during the whole first trimester. She can continue with these or just switch over to the prescribed prenatal vitamin. We continue to educate the patient about pregnancy, habits, expected milestones, and eventually we'll draw labs near the end of the second trimester. So at those visits, the nurse obtains the patient's weight, her vital signs, and dipsticks a fresh urine sample. The focus on the vital signs is primarily the blood pressure, and for the urine, check for protein and glucose. Ask her how she is feeling. Ask her about any concerns she has and that she wants to discuss with the provider. She should begin to feel the baby move between 17 and 20 weeks. This is known as quickening. And please note, the Khan Academy video about pregnancy says fetal movement begins earlier, but quickening does not happen until between 17 and 20 weeks. So the baby moves, but the mom can't feel it yet. The first fetal movement, once again, is called quickening. During the visit, the obstetrician or the nurse practitioner discusses patient concerns, measures the fundal height, and listens to the fetal heart using a Doppler. The fundal height is measured by placing a tape measure on the symphysis pubis and extends it to the top of the uterine fundus. In general, the fundal height should be plus or minus 3 centimeters of the gestational age. So if a patient is 17 weeks, the fundal height could be between 14 and 20 centimeters and still be considered normal. By 20 weeks, the uterine fundus should be at the level of the umbilicus. In the early second trimester, genetic testing in the form of CVS or amniocentesis is done. Remember, prior to the CVS, the patient has to have cultures of the cervix done and results sent to the testing center. A perinatologist who specializes in this procedure does the CVS. On the other hand, an amniocentesis can be done in an OB office. We have to wait until at least 15 weeks to do this because a pocket of amniotic fluid has to be large enough that we can draw the sample from within the uterus and not hit the baby while doing so. In addition to the invasive tests, the patient is a candidate for either the Harmony test and the AFP triple marker or the quad screen. The Harmony test is a blood test that is actually looking at fetal DNA through the mother's blood. It's an interesting and a new test, and it's probably going to replace CVS and amniocentesis in the future. Look at the video that addresses the Harmony test and refer to your preclinical fetal diagnostic test document to refresh your memory about these tests. You should be familiar with the purpose of the test, what each has the potential to detect, how and when the test is done, and how to counsel the patient about each. We do need to obtain a consent from the patient prior to doing any of them. At each visit, we counsel the patient regarding diet. Is she gaining too much or too little weight? Is she out exercising or not? We teach her to begin fetal kick counts in the later part of the second trimester. Once the baby starts moving, the mother notices her baby's normal pattern of activity. The nurse needs to reinforce that the baby should continue to move throughout the pregnancy until it is delivered. Unfortunately, some women listen to their family or friends when they have concerns about fetal movement. And the advice they get from these family and friends is often not to worry because babies slow down when getting closer to term. This is not true. Their movements may differ because the baby is so compacted in the uterus, but the pattern of movement and frequency should be the same. Look at the fetal kick count documents posted on Blackboard. So in addition to kick counts, we review warning signs. Braxton Hicks contractions, which are contractions that occur but don't cause cervical dilation, and we have to differentiate them from labor contractions. Now, the patient can't always tell what's causing the cervix to dilate, but Braxton Hicks are more erratic than true labor contractions, but both can have discomfort. We did discuss bleeding, what to do if there is decreased fetal movement. Is she having headaches? Call us. Has she experienced any unusual swelling? She needs to call us, as well as report any signs of urinary tract infection. So all of these are things we should review with the pregnant patient at each prenatal visit. Labs are drawn between 24 and 28 weeks gestation. We collect a CBC, screening for anemia. We also do a 1-hour diabetic screen on everyone unless we have already diagnosed gestational diabetes or she has known type 1 or type 2 diabetes. An antibody screen is added if the patient is Rh negative. If the results indicate anemia, the patient is started on over-the-counter iron. She may need it once a day, twice a day, or 3 times a day. It depends on the level of the hemoglobin, and the obstetrician or nurse practitioner will let you know what you need to tell the patient. If the antibody screen is negative, the Rh negative patient returns within a day or 2 to receive RhoGAM. Remember, you, the nurse, need to contact the patient to let her know the results and of the need to return. If the 1-hour diabetes screen is positive, the patient returns within a few days for a 3-hour GTT, and refer to the gestational diabetes lecture regarding diabetes and pregnancy. So this slide reviews how to perform and interpret the diabetic testing results. The second trimester goes by quickly. With good prenatal care, the mother and fetus will enter the third trimester in a healthy state. The couple looks forward to and prepares for the eventual birthing experience by attending childbirth education classes, breastfeeding classes, and newborn care classics. We want to encourage them to sign up for these classes and attend as often as possible. So this ends the lecture on health maintenance in the second trimester. Thanks for listening.